What's up, guys? It's Nora, and I'm here to tell you guys about part 2 of my new diagnosis, what it exactly is in my surgical experience, and how it went wrong. As I had said before, I had gone to my surgeon. I had had 3 abscesses. I was concerned I had a fistula going on, an unresolved infection. I was concerned that I had Crohn's developing, but again, through this whole process, still had no symptoms of IBD, although GI had come to me and said, well, the only way to really tell is to do a colonoscopy. And I said, hold up. I said, let's do some other blood test, stool test before I just go right to colonoscopy, because that is the last thing I want to be doing right now. And although I wasn't planning, you'll still have to wait to hear the diagnosis that I actually had from all this. My surgeon had said on Tuesday when I went in, I can book you for surgery on Wednesday, and I said, let's do it. Also, keep in mind that I've been put under 11 times before, so being put under is not something that scares me. What scared me the most was, what was he going to find once he actually brought me in and opened me up? As well as, what was I going to feel afterwards if he was going to cut open this abscess and then stitch me up? I really had no clue what the plan was. So Wednesday came, I did all of the classic things that you have to do for surgery. I went and got a COVID test. I didn't eat for like a certain amount of hours, which actually I was more hungry for this than I usually am for a clean out. And also, I want to say that I'd never been put under in an OR. I've been put under like in an emergency department for my wisdom teeth and for all my colonoscopy endoscopies, but those were all outpatient. And this is still considered outpatient, but I didn't know that this was going to be different when it came to like the way they're going to sedate you and breathing tube wise. Because all I'd ever had was like conscious sedation with a nasal cannula or a face mask oxygen-wise. But I figured it out the hard way once I got to the hospital that they were going to put a breathing tube down my throat, which is a new experience for me. So I went, Jacob dropped me off at the hospital. I went in. I'm very comfortable with this hospital. It's Main Med. It's where I go usually. I also was very nervous when it came to getting the IV. Only because, and for those who know me, know that I get Remicade very frequently. Every 8 weeks, I get an IV. IVs don't scare me. It is that I'm hard stick, and that the only 2 places that people can now get access on me are both my elbows, which can create a problem. But I make it very known to people that I am a hard stick, and that if you are not confident in doing it yourself, please go and get somebody, because otherwise you can create a lot of problems for me. And I already have like medical PTSD from prior times being infiltrated and having people fish at me when I tell them not to, and then also people just not being able to get access on me, which if they can't get access on me, they can't do surgery. So I showed up. I had a nurse that, quite frankly, seemed relatively new, which tipped me off that she probably might not be able to get access on me. I did what I usually do, is I make it very clear, like I just said. I said, I'm telling you right now, I'm a hard stick. The 2 places to get me are my elbows, blah, blah, blah. Like, if you aren't confident, like, don't, feel free to just go get another nurse. I'm not going to be mad at you. And she was like, well, I have a vein finder that I can use on you. Which I've never had a vein finder used on me. So I said, okay, I'll give you a chance with the vein finder. So she went, she brought it back, and she was looking at specifically my forearms. And I've never gotten an IV in my forearm, but I've been told that they are very painful, and so I was very hesitant. Also, for surgeries, they usually get you with an 18 gauge, which is a larger gauge than a normal IV infusion would be. So I knew that she was going to stab me with a large needle, and I was very anxious when it came to that, and plus because she was a new nurse. So she offered to do the vein finder, as well as I've been offered in the past to do the subcutaneous lidocaine that's supposed to numb the spot that they put the IV in. And I've always said no to it, because usually I'm like, well, that's 2 pokes, and I really could care less for that. But I said, fine to her. I'll give her a chance. She could be really great, and I don't know. So she used the vein finder, she used the lidocaine subcutaneous, and she put the IV in. All seemed well. It did hurt in my forearm, but I was like, fine. If this works, then okay, maybe I have a new spot that I could possibly get IVs in. The only problem is that it's kind of like a deep spot on my arm. So she stuck me, she hooked me up to the saline. It wasn't infiltrated at the time. Nothing was bubbling when she pushed the saline, which I've had it infiltrated before, so it's very easy for me to feel it and look at her and go, yeah, that's not right. So it seemed like it was working. She hooked me up to the saline, and I waited. And I waited and for like all the people to do their classic, like, anesthesia comes in, the nurse comes in, the surgeon comes in, everybody comes in and does their whole spiel, and then I signed consent forms, and then they whisked me away. I think the next person in was my surgeon, and anesthesia talked to me, and they came in, and this was at this point where I found out that I was gonna have a breathing tube, which is fine. I just had not experienced that before. So I said, fine by me, that's cool. They told me they were gonna give me Versed before going into the OR because they don't like patients to like be aware of what's happening, and then from that point they'd give me propofol. All fine and dandy, my IV was working, we were good rolling. Well, we weren't. At this point was when things started to become very problematic. My surgeon came by, talked to me, the anesthesiologist and his assistant, I think it might have been a CRNA, I'm not really sure. They came in and pushed Versed, and it hurt so bad in my IV. And I am someone who knows that drugs like that should not hurt in your IV. And at this point, there was no signs it had infiltrated, no signs of phlebitis or anything, nothing that was indicating that something was going wrong with my arm. But it hurt, and I yelled at them for it. I was not having it. I was like, that hurt. That made me very uncomfortable. I'm a nurse, I know. It shouldn't feel like that. I get IVs all the time. They were like, oh, well, we just gave you the Versed. You're not supposed to remember anything past, like, us wheeling you into the OR, so you're not going to remember it. It's fine. We don't know why it hurt your IV. Maybe we pushed it a little too fast. I don't know. It's no bigs. So they rolled me back to the OR, and let me tell you, Versed didn't work. Now, I don't know if at this point my vein had blown, and I don't know if what was happening was because I did have the subcutaneous lidocaine. I've had no problems with this happening with my IVs before, but there was something clearly going on. It was very painful, and that's not right. So they wheel me back to OR. They're telling me, you're going to be sleepy, you're going to get knocked out, and I'm like, no, I'm very aware of this. And they were like, well, I guess the new standard of practice, which used to not be when I was a kid, is that they push IV lidocaine before they push IV propofol, because I guess propofol hurts your veins and is supposed to burn, but quite frankly, I never remember it burning when I was a kid, and I've gotten it multiple times, like I said. So they brought me in. They were like, yeah, her IV's bothering her a little bit. Well, whatever. Like, we don't know what it is. I think they pushed saline, and then they pushed IV lidocaine, and I, again, yelled at them. And I'm not usually someone who, like, yells at, like, doctors, but I was like, oh my god, that hurt. No, you're not doing it again. No, like, don't use that. Like, something's wrong here. And they were like, well, we'll find access somewhere else. So they take my arm, but I'd already told the nurse, my hand IVs always blow. They never even get access on me. They usually never even get point past of getting the cannula in before my entire hand will blow and will bruise. I already at this point was like, there's no way in hell you're going to get access on my hand. But the anesthesiologist was being a little cocky himself and was like, no, we're going to try it anyway. And I was like, well, is there something else like you can do for me? Like, can you give me like the laughing gas, the nitrous oxide? They were like, yeah, we can give you that nitrous oxide, even though I was like, you're not going to get access on me. And he was like, well, we'll try it. So he had my arm. Now, I had moved over to the surgical bed from the stretcher. He had my arm off the surgical bed, and he was sitting on a chair, like a rolly chair, and he had my arm off the bed at a slant with my hands like this, and he was like, you need to relax your hand. And I was like, how am I supposed to relax your hand when you want it at this kind of an angle to put an IV in? Like, that's just not gonna work. So I tried to be a good patient. I knew to take deep breaths. I was tripping like I've never, like, had this experience before with nitrous oxide. Like, I, again, even with the Versed, completely aware of everybody. There was someone above me. The people and surgeons were going around me. I had one male anesthesiologist working on my hand, and I had one of them next to me trying to tell him, like, they were trying to, like, go back and forth as to, like, what to do about it, because they were now nervous that my IV wasn't going to work and that they weren't going to be able to knock me out. I have this guy over me trying to, like, trip and, like, knock me out, but I'm still, even though I'm, like, completely tripping and, like, things are happening in a weird motion, I'm still completely aware of everything happening, which was probably the worst part of it. And so he tries to stick my hand, again, with an 18 gauge, and it hurt so bad. I even told them, like, they stick me with the neonate IVs, the 24 gauges for my infusions when I'm a hard stick, and they have to stick me with, like, a shorter length catheter. But they didn't want to listen to that, so they stuck me, and they were like, well, we can't get her hand relaxed, like, we'll try one more time. And I was like, no, like, you're literally not going to get access. And they completely ignored me, which I technically could sue them for, But I just wanted it all to be over at this point. So they tried to stick me again. It hurt so bad, them sticking a huge needle in my hand after I told them it wasn't going to work. So then at this point, they couldn't get access on me, and they were like, we don't know what to do about it. So they were like, we're just going to quickly push the propofol and hope that she knocks out, because they were feeling my IV. They're like, we don't feel it being infiltrated or whatever. So they quickly pushed the propofol and I knocked out. I had surgery, of course, and as I was being wheeled to like the post-op room, I was like coming to. They had the endotracheal tube still in me, so the breathing tube was still in me, and then they had a mask over me. I knew that the breathing tube was in me because I could feel it, and kind of like when you wake up, you start getting a gag reflex. Some people freak out, but I think just because of my medical history and me being a nurse, I knew that wasn't going to help me. So I actually, as they were wheeling me back and I was still half out of it, took my mask off and went like this and pointed to them. And they, while I was laying there being wheeled, they yanked out my breathing tube, which didn't bother me at all. I got back to recovery. They tried to push saline through my IV again, and once again it hurt so bad. I yelled at them. I said, I'm done using it. I said, I don't want you guys touching it anymore. I don't want anything put through it. If anything, I want it taken out. I don't care if it's just sitting there and nothing's going through it. That's fine by me. If it's just a saline lock, but I don't want anything being put more through my IV, and I will not allow it. I had the anesthesiologist come by and formally apologize to me that they had not listened to me in the OR. That doesn't happen. Like, that's freaking embarrassing that the anesthesiologist had to come by and formally apologize that they did not listen to the patient in the OR. They wanted to give me IV hydrocodone, and I refused it. They were like, fine, well, as long as you can swallow this water, like, we'll give it to you a pill. That was the wrong choice. Turns out hydrocodone makes me very, very sick. I was sheet white the whole way home and was very, puky and vomity the whole night, almost. I didn't actually vomit, but I was very gaggy, pale white, didn't want to eat anything, which turns out my dad has the same reaction, so thanks, Dad. But I had to sit there, I think, for like an hour before Jacob picked me up, and when a different nurse, went to go pull my IV, it was infiltrated at that point. I don't know. It wasn't like I say, it was bad infiltrated, but it clearly hadn't been completely infiltrated the whole time. Pretty much looking at my arm, it was bruised all the way down from where my IV was, which has happened before with me being infiltrated. But what was really interesting was I had phlebitis. Now, phlebitis is not a very common thing that people get. That's something you learn in nursing. Phlebitis, to explain it to people, is inflammation of the vein, and it feels like almost like a rope or a cord. I could feel my hardened vein from where they had stuck me all the way up here, all the way down to my elbow, and that lasted 2 or 3 days. So I had extreme bruising on my arm, as well as could feel my hardened vein for, like I said, 2 or 3 days. So in the end, at some point, my vein either was leaky or infiltrated, possibly towards the very, very end, maybe when I was in surgery, as well as something caused phlebitis in my vein. I don't know if it was possibly, like I said before, the subcutaneous lidocaine, if that irritated my vein. It could have been the Versed, very well could have been. The saline dripping slowly into my IV to keep it not like clotting or anything didn't bother me at all. But pushing any drugs through it was extremely uncomfortable and painful. So I'm not really sure what happened there or why, but I know that I will never be allowing anybody to get IV access on me in my forearms ever again out of fear of them getting phlebitis. So in the end, the diagnosis was pilonial disease. I had been getting, now there's pilonial cysts, and then there's pilonial disease, where I pretty much, near my tailbone, which explains all of the tailbone pain that I've been having, there is a cavity or a sinus that has this infection that doesn't go away. It usually is from like a hair that somehow has like wedged its way into your skin. I don't really know how, but that hair stuck in there creates a recurring infection. So this infection had been tunneling to different areas in skin down near my butt, and had been causing abscesses. This could be caused by like prolonged sitting. The surgeon said that some people are just genetically, the way our body is made, they're more predisposed to have this condition. Unfortunately, I just had to experience, and we thought maybe it was IBD. My surgeon did say that it was a quote unquote great moment in that OR when he discovered the sinus cavity, because pretty much he had to drain it and then look for that tunnel as to where the cavity was, which he had looked for the 3 previous times. In the end, regardless of whether I had 1, 2, 3, or 4, I would have had to have that cavity drained and cut open. So in reality, even after the first one, I should have been sent to the OR, but I didn't. Unfortunately, I had to have 4 of them to be sent to the OR finally. That could also be said because of COVID. But in the end, my new diagnosis is pilonial disease. He cut it open. He let it drain. He didn't like surgically suture it back up. So I did recover after about 2 weeks. It finally started healing up. It's supposed to heal inside out. And I now no longer have a straight butt crack. He said it could reoccur if I was like sitting for like super, super long hours, like if I was on an airplane for like multiple hours, but it's not very common. And as long as you're like getting up and walking around like every hour, you should be fine. You know, like he could also say, you know, if I was sitting in the office all day long, but most likely it's not going to reoccur. You could say it's correlated to my IBD, you could say not, but that is my surgical experience. It did not go the way I wanted it to, and I did not have some certain outcomes that I wanted it to, but it needed to happen. So thank you guys for watching. I hope you guys enjoyed, and I'll see you guys next time.